Good morning, everyone. This is Terry Kearns, the chair for the SURG Response Subcommittee. And I will apologize in advance because I'm having technical issues today, so I can't get my computer with a camera to work. So I'll be online, just no image. So my apologies to everyone for that. What we'd like to do now is call the meeting to order. And Crystal, can you do roll call?
Shayla Holmes.
Present.
Dr. Terry Kearns.
Present.
Nancy Lindler.
Present.
Christine Payson.
Present.
Great, we have all members present.
Okay, great. Thank you. So we have our quorum. We'll go ahead and proceed. At this point, we'll open to public comment, and the public comment will be received via Zoom by raising your hand or unmuting yourself. And when asked for public comment, which we are, it'll be limited. Public comment will be limited to 3 minutes per person, and no action may be taken upon a matter raised during a period devoted to comment by the general public until the matter itself has been specifically included on an agenda as an item upon which action may be taken pursuant to NRS 241.020. If you're dialing in from a phone, please dial 669-444-9171. And when prompted, enter the meeting ID 868-3331-1069. And then you would press *9 so the host can prompt to unmute. Do you see any public comment?
I do not see any raised hands or anyone else indicating that they would like to make public comment at this time.
Okay, we'll give it just a second more so that if anybody's trying. Okay, I think we can move on. At this point, we will take agenda item number 3 to review and approve the October 30, 2023 Response Subcommittee meeting minutes. If anyone has any changes they would like to make, or if someone has a motion to approve the minutes as they are.
This is Shayla Holmes. I will make a motion to approve the meeting minutes as they are.
Christine
Thank you.
Payson, second.
Thank you. So we have Shayla Holmes making the motion and Christine Payson seconding that. All in favor, say aye.
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 Any opposed? Any abstentions? Hearing none, the meeting minutes from October 23rd are approved, and we'll move on to the next agenda item. So as agenda item number 4, what we wanted to do was to do a subcommittee reorientation. And as part of that reorientation, we did want to just highlight a couple of items that have been discussed at our last SURG meeting, but just wanted to ensure that our subcommittee members are aware of these items. The first item we'll talk about is that with attendance, after speaking with our DAG, the attendance beginning March of 2024, the attendance will be tracked, and any member who goes below a 75% attendance rate for the subcommittee or the SURG regular working group meetings will be asked if they wish to continue serving. This counts for both excused and unexcused absences. Really, the unexcused and excused do count toward that 75% attendance rate. And if you cannot attend a meeting, please email SEI staff at least 4 business days in advance. And the reason for this is really more so that we can ensure we have quorum, or if we need to reschedule the meeting, we can do so. And we do request for the guidance in the bylaws that the submission for and be provided in advance, and that's why we asked for that 4 days in advance. Does anyone have any questions? I think we had previously a little bit of questions if it was subcommittees and SURG, so that's why we just wanted to clarify that. Are there any questions from the committee members on that? Okay, hearing none. It sounds like we'll go forward now with the recommendation process and talk about the recommendation process. As you all know, SCI did send out surveys similar to what we did last year, and it is expected that recommendations will be submitted by the subcommittee members using that Survey Monkey process, as I said, like we used last year. But please note, some of the questions in the survey may be different this year, depending on SURG member feedback, which will be discussed at our April 10th SURG working group meeting. Crystal, do you want to speak to the survey at this point, or do you want to set the next item?
All right. Just letting people in, and I can speak to the survey. Sorry, I went ahead in the thing. So I'm going to just give an example, walk through the survey. It's basically at this point the same as last year. And we really do ask that we are hoping to get responses from all of our members, and our group has been pretty good about submitting recommendations. Each person on our subcommittee has traditionally submitted recommendations. And that wasn't always the case for some of the other subcommittees. So we're really just emphasizing that this year. I'm going to walk through it quickly, and this will just be a test. So I'll go in later and delete this, but this is what the survey looks like. So you'll select your name, and then it will open the page with I think these are all of the questions. So just as with last year, you're asked to describe the recommendation, provide any justification or background, and then research links. And we would just ask that you fill these out as completely as possible all the way through the survey, and keep in mind that often what is written in this recommendation survey goes forward in the annual report. We do review it, we clarify things, we clean it up, but it does often end up in that annual report. So the more complete and professional the writing is, that does really help to keep the information flowing between our meetings as well as when we get to the annual report. And then you'll just select the requirements that AB 374 has, and these are specific to the response subcommittee. So that includes D, I, K, L, M, N, O, and P. You'll select which one of those areas the recommendation is most aligned with, and then you'll select a cross-cutting issue that includes B, C, H, and Q from section 10, as well as which special population. And then we are still trying to find, we still like to know if it's a BDR, and I think that's really important for this year's recommendations, because we do have the chance possibly to get BDRs submitted for the next legislative session. But there's also other options there: expenditure of opioid funds, DHHS policy, whether or not it's a short or long-term recommendation, and if it requires a fiscal note. On both of those, you're able to say unsure, and that's okay, because we understand that these recommendations evolve over time, and we will continue to track how they do so before we get to the annual report. This is a scale question, so you're rating the impact as well as providing a description of the impact, the urgency, and the current feasibility, capacity and feasibility. What's slightly different this year is that we got to the end last year and we started to talk a little bit more about racial and health equity. We have that now included in the survey from the beginning. So you'll ask to do the scale as well as put in a comment. And then any suggestions for presenters. So that is our survey overview, and I can take questions if anybody has any.
If there are no questions, I just have a couple of comments that I wanted to make before we go on to the next agenda item, which we're going to talk more about the what is been tasked to us as a subcommittee. Is it is encouraged that each member submit at least one recommendation, and in submitting the recommendation, it doesn't have to be a new recommendation. It can be one that we had previously that maybe there's a change in it or something we want to follow, or that wasn't listed as maybe a ranked recommendation, but was an unranked recommendation if there's additional information. As I said, in the next agenda item, we'll review those areas that the response subcommittee addressed in the 2023 recommendations that align with AB 374 Section 10 requirements, and looking at what are also cross-cutting and then the subpopulations. And this is from me, some anecdotal information that I would just like to add. I have presented our recommendations to numerous other groups, such as the Clark County Opioid Task Force, the ACRN, to some of the Behavioral Health Regional Policy Board meetings. So there is a lot of interest in what our recommendations are, and the feedback that I have gotten from all the groups on our recommendations is that the groups feel that there was a lot of research, intent, and thought put into our recommendations. And I think that really goes to what's on that survey, with making sure if there's resource documents, if if it's a policy issue versus a BDR versus a funding, or all three of those things. So people are interested in our SURG recommendations, and it is something that is useful to other groups. So I just wanted to highlight that to all of the members on here. I would also, at this point, again, ask if there's any questions on either attendance or on how to submit a recommendation, or to submit a recommendation or a suggestion for a presenter.
Chair Kearns, this is Crystal Duarte again. I just wanted to note something that I noticed is different regarding presenter recommendations.
Please go ahead.
It looks like the survey requires responses to some of those questions, and the recommendation for a presenter is at the end. So if you have a request for a speaker that you don't have yet connected to a recommendation, it's okay to email me or Chair Kearns to let us know if you're formulating a recommendation but would first like to hear from someone. I just wanted to note that because it does look like the survey, you'd have to answer several other questions that you may not have answers to if you don't yet have a recommendation formulated.
Thank you. Did someone have a question?
I heard that too, but I don't think it was someone speaking.
Okay, just some background noise. Okay, that sounds good. We can move on to the next agenda item. And at this point, we're at agenda item number 5, review subpopulations and AB 374 Section 10 requirement addressed in the 2023 recommendations. So as you can see on here, based on the legislative language and having had some of the those that were instrumental in bringing that legislation forward, that being Vice Chair Tolles and Dr. Woodard. We went through that section 10, subsection 1, that has the A through Q to get the guidance to determine how the subcommittees should align. So looking at which would go to prevention, which would go to treatment and recovery, and then which would go to the response subcommittee. And again, some of them are cross-cutting. So for those that are cross-cutting, they would go to all of the subcommittees. If you want to move on to the next, we'll look at the 2023 recommendations and the language. So I know this is super busy, but this is straight from the legislation and the language that was assigned to the response subcommittee. D was to work to understand how residents of the state were involved in the criminal justice system, access support for treatment and recovery from substance use disorder at various points, including without limitation by reviewing existing diversion, deflection, and reentry programs for such persons. Develop strategies for local, state, and federal law enforcement and public health agencies to respond and prevent overdoses, and plans for implementing those strategies. K is recommend strategies to improve coordination between local, state, and federal law enforcement and public health agencies to enhance the communication of timely and relevant information relating to substance use and reduce duplicative data collection and research. L is evaluate current systems for sharing information between agencies regarding the trafficking and distribution of legal and illegal substances, which are associated with substance use disorder, including without limitation heroin, other synthetic and non-synthetic opiates and stimulants. M, study the effects of substance use disorder on the criminal justice system, including without limitation law enforcement agencies and correctional institutions. And study the sources and manufacturers of substances which are associated with substance use disorders, including without limitation heroin, other synthetic and non-synthetic opiates and stimulants, and methods and resources for preventing the manufacture, trafficking, and sale of such substances. O was study the effectiveness of criminal and civil penalties at preventing the misuse of substances and substance use disorders and the manufacture, trafficking, and sale of substances which are associated with substance use disorder, including without limitation heroin, other synthetic and non-synthetic opiates and stimulants. P, evaluate the effects of substance use disorders on the economy of the state. Next. And then the language that is cross-cutting is B, to assess evidence-based strategies for preventing substance use and intervening to stop substance use, including without limitation the use of heroin, other synthetic and non-synthetic opiates and stimulants. Such strategies must include without limitation strategies to help persons at risk of substance use disorder avoid developing a substance use disorder, discover potentially problematic substance use in a person and intervene before the person develops a substance use disorder, and C, assess and evaluate existing pathways to treatment and recovery for persons with substance use disorders, including without limitation, such persons who are members of special populations. This component is aligned to the treatment and recovery subcommittee, but all subcommittees are assigned to review how recommendations impact following special populations: veterans, elderly persons and youth, persons who are incarcerated, persons who have committed nonviolent crimes primarily driven by substance use disorder, and other persons involved in the criminal justice or juvenile justice, pregnant women and the parents of dependent children, lesbian, gay, bisexual, transgender, and questioning persons, people who inject drugs, children who are involved with the child welfare system, and other populations disproportionately impacted by substance use disorder. Looks like we continue on the next slide. H, examine qualitative and quantitative data, understand the risk factors that contribute to substance use disorder and the rates of substance use and substance use disorders, focusing on these special populations. study, evaluate, and make recommendations to the Department of Health and Human Services concerning the use of money described in section 10.5 of this act to address substance use disorders with a focus on the use of money described in subsections 1, 2, and 3 of section 10.5 of this act to supplement rather than supplant existing state or local spending, the use of the money described in section 10.5 of this act to support programs that use evidence-based interventions, the use of the money described in section 10.5 of this act to support programs for the prevention of substance use disorder in youth, the use of money described in section 10.5 of this act to improve racial equity and reporting by state and local agencies to the public concerning the funding of programs to address substance misuse and substance use disorder. That's a lot. So at this point, what I'm going to do is actually turn this over to Crystal and let her address it, because SEI put a lot of work into the summary of the recommendations and the ranking. So Crystal, if you could please explain this.
Sure. So the slide that you see now is something that also is presented in the annual report, as well as in the handout that was posted as part of this meeting. So if it's easier to look there at this information, please do so. It's hard to get it all on the slide. But what you're looking at is the order of all of the recommendations, 1 through 18, and then we had 2 unranked recommendations. On the left, you'll see the subcommittee from which those recommendations originated. And if you remember, we have some labeled HR, that stands for harm reduction. There was a meeting in April of the full SURG to talk about ideas around harm reduction, and then the prevention subcommittee was tasked with putting those forward. So you'll see P for prevention, T for treatment and recovery, R for response, and HR for harm reduction. And then on the very far right of the screen, you see which of the legislative components were assigned to each of the subcommittees. You can see this subcommittee response has the most assignments. And then the X's stand for which one of those items did someone making the recommendation note that that recommendation impacted. So whoever submitted recommendation number 1 noted that it impacted areas B, G, H, and J. And you'd have to go back to that other document to look at exactly what those areas are. If you look just at those that have an R, so that includes number 9, you can see it impacted quite a number of areas across the board, including many assigned to the response subcommittee. And then I would look at 11, which is the same, as well as 12, also a response subcommittee recommendation that addressed quite a few, although fewer of the recommendations. And some of those, as you'll see, are across other subcommittees' responsibility. So for example, recommendation number 12, submitted by response, did touch on, we'll see as a cross-cutting issue, but did touch on some of the other areas. One thing I would note is there was only one area in which none of the recommendations from any of the subcommittees dealt with, and that was L. And that is assigned to response. So I am just going to go back because I don't have these committed to memory, but
I have it, Crystal. I can, I was going to say I could read it, but go ahead. You're good.
Okay, thank you. L is evaluate current systems for sharing information between agencies regarding the traffic and distribution of legal and illegal substances. So no one noted that a recommendation submitted last year responded to that part of the legislation. That's the purpose of the charts that we have here in the slides, as well as the handout, is just to show where there may be areas in the future for subcommittees to focus on. Was there anything else you wanted me to address with this slide, Chair Kearns?
No, the only thing that I would add is you can note too that P, it looks like O and P are also areas that didn't have a lot. So one of the things we hope to do is try to see if we can address these populations or these components of the legislation not just when I say we, I don't just mean the response subcommittee, but all of the subcommittees this year, so that we can hopefully address some of these areas that we didn't cover as well last year. And again, with a focus not only looking at opiates, but looking at all substances, which I feel like we really did a good job last year of focusing on more than just opiates. Does anyone have any questions? Because I know that that chart is a lot to look at, but I think it's laid out pretty well on how we addressed everything that we were supposed to address. Okay, hearing no questions, let's go ahead and move on. Crystal, do you want to lay out this one again?
Sure. Let me go back again. Oh, here we go. So this is similar, just noting the populations impacted or expected to be impacted by recommendations. And this comes from section 10, component C of the legislation, I believe, lists target populations. And so you see those listed across the top. The subcommittee is noted, and the order of the recommendation is also noted there on the left. And there were no populations that were not addressed, as I remember. You can see often other populations overly impacted by substance use was often selected by people making recommendations. And there were fewer recommendations possibly for things like children who are involved with the child welfare system. That's just one way to look at the chart.
One thing I would add to what Crystal has already addressed is, if you'll remember from this one of the SURG meetings, we had the presentation on Choice Point, and it was a tool that can be used and to address special populations and for racial equity. And from what I remember from that presentation, we did a good job at that, but we still have to decide whether we're going to use that choice point tool or how we actually implement that choice point tool is where we're, I think, at with that. But I think because we are focused on the special populations and the way that we implemented it, looking at the impact and the urgency and all that, we were able to really hit the majority of what she talked about with the choice point tool. Can go ahead and move on to the next. And this is really just for our just to put it back in everybody's the front of their memory, our recommendations for last year's, the 2023 response recommendations. The first was to evaluate current availability and readiness to provide comprehensive behavioral health services to include but not limited to screening, assessment, treatment, recovery support, and transition for re-entry in local and state carceral facilities. For example, implement follow-up and linkage to care for individuals leaving the justice system. And remember, we took language from one of the other subcommittee recommendations and added that, for example, piece. The next one was recommend the allocation of funding to support the development of a Medicaid re-entry section 1115 waiver to increase health care for people leaving carceral facilities and to support readiness of carceral facilities to implement the 1115 waiver. The next one is to recommend legislation to require Division of Healthcare Finance and Policy to apply for and implement the 1115 waiver to increase healthcare for people leaving carceral facilities and ensure there is an evaluation of readiness for planning and implementation. For this one, I would add, we hit a number of things. We hit possibly a BDR. We hit also policy issue for DPH. So we did hit a number of the functions on this one. Next. is to leverage existing programs of funding to develop outreach response providers and or personnel that can respond to any suspected overdose or to those who are provided treatment for an overdose in a hospital, emergency room, EMS, and offer follow-up support, referrals, and services to the individual and those impacted by the overdose. For example, other persons with a personal and or emotional connection to the victim, surviving family members, and or post-mortem services for families following an overdose. Providers, and or personnel to be deployed to anyone being released from institutional and community settings. Examples being hospitals, carceral facilities, and other institutional settings, who is being discharged post-overdose or suspected overdose. Ensure this recommendation is included as the build out of Nevada's crisis response system is occurring so that tailored intervention for individuals who have survived a non-fatal overdose is included. The next is to recommend that a compliance study be completed on NRS 2.59.050 number 3 and 2.59.053. That compliance study was looking at the prior legislation that said that the counties that refer to Washoe County Medical Examiner's Office or Clark County Coroner's Office of suspected overdose are referring them. And then the second part of that was that whatever the forensic pathologist determines is the cause of death is what has to go on that death certificate. It couldn't be changed by whomever it is that that death certificate would go back to. And then the second part of that is provide adequate funding for medical examiners' offices to include death scene investigations, forensic pathologists, forensic epidemiologists, and toxicology testing to determine specific cause of death. I will add that I spoke to both the Clark County Coroner's Office and Washoe on this because there's grant funding that's available, but the grant funding really limits the use of the funding, and it typically can't be used for many of these personnel needs. Go on to the next slide. The next one was to recommend the Nevada System of Higher Education conduct a feasibility study to understand the true cost of implementing wastewater-based epidemiology in our state and its ability to support community response plans. Funding for this study may be available through the Fund for a Resilient Nevada. And that was our recommendations. So well, I just bring those up to you because again, as we're looking at the possible recommendations for next year that we come up with, there may be some in here that we want to recycle and look at again or refine them or provide more background and data if we need to, such as if a compliance study is done, that may be something that we want to look at. At this point, are there any questions on our recommendations previously and what we're tasked with doing with our recommendations this coming year? I'll pause and take a drink. I feel like I'm doing all the talking. Go ahead and move to the next slide. For our planning for 2024 response subcommittee, there's a couple of things that that we looked at from the chairs of all of the subcommittees. And one of the things we wanted to provide for each of the subcommittees is we wanted to, first of all, there's a couple of questions we'll ask you. I'll go through all the questions and then we'll come back to them. The first is, what would you like to accomplish with the response subcommittee this year? The second is, what is your vision for developing recommendations? Should we focus on the refining of last year's recommendations or create new recommendations? The next question is, where do we want to be by September when the SURG working group will begin narrowing down the recommendations to include in the annual report? And the last one is that looking at additional presentations and as well as having those for the upcoming members and speakers for those. So those I went through them just so you could start thinking about them, and I will open the floor up and we'll address the first question with you is, what would you like to accomplish this year as our subcommittee? Any thoughts, subcommittee members? Shayla Holmes, I see your hand up, please.
Yeah, this is Shayla for the record. I definitely want to do some research looking into those areas. Was it NOP that we haven't made any recommendations for yet as a whole? I also am curious, and I probably should have asked this question during the last agenda item, but we went over the 2023 response recommendations, but I'm also curious about perhaps any of the 22 response recommendations that might still be relevant. So I'm not sure. I mean, I guess I'm torn between the two, right? Like I would like to see, you know, some of our previous recommendations continue to be worked on because I think that they're really beneficial. But I also think there's a lot of work to be done in some areas that we haven't yet touched on. And then I guess the side question there is anything from the 2022 piece. Because I know there's a couple recommendations that I had made during that, some of which I think have been sucked into some other recommendations which work, but some that I still think might be beneficial if reworked, reworded, and some additional research was added.
Yeah, that's a good point. Maybe for our next meeting, we can pull up some of the 2022 recommendations. One that I remember very well that was from 2022 and is that whole coming to some sort of resolution or, you know, the conflict between the Good Samaritan Act and the Drug-Induced Homicide Act. I know that that is still research that we need to look at. Another one is the overdose fatality review teams. And that one we put on hold because we're waiting to see what the Clark County Overdose Opioid Task Force comes up with. Albeit I will highlight their tasking is not necessarily that of an overdose fatality review committee, but looking at really all aspects from prevention and the whole gamut, not just simply, and I say simply, not that it's simple, but it's a really Herculean task, but just doing overdose fatality reviews. So that one was on hold till we saw what their report was. So those are two that come to mind. And one of the things I will highlight through some of the work that all of our SURG committee members did with the ACRN is that it was taken forward, and that new opioid technical assistance center, I think is what it's called, out of UNR. They are going to try to tackle some of the Good Samaritan, the conflict between the Good Sam law and the drug-induced homicide, and do some education and outreach with that. So that's been pushed to them. So I do know that. But your points are well taken, and maybe we need to pull up what is continuing. I would also add, I know that with the wastewater recommendation, there's, I think, more research and background on that, and some areas have been using this. So maybe that's something we can look at. For some reason, it seems like some of our recommendations are either lower ranked or not ranked. So maybe that's something we need to really address better as our subcommittee in looking at why those are ranked lower or unranked. So I'll put that out there to the group as well. Christine?
Thank you, Christine Payson for the record. Chair, could you just give me that group at UNR that's working on the Good Sam law? What's that group called again?
It's I think it's the called the Opioid Technical Assistance Center. It's out of Casat up at UNR. And I can also get you the specifics and send it to you.
Great,
as well. Christine, is your hand still just raised? Or do you have another thought?
I just forgot to lower it.
Okay, no problem. No problem at all. Any other thoughts from the committee members on what we want to accomplish? I think those are all great suggestions that you came up with, Shayla. I appreciate you you bringing those. Those are well thought, and something we'll work on and bring forward for the committee. The next question is, what is your vision for developing the recommendations? Should we focus on refining or coming up with new ones? I think Shayla somewhat addressed that in saying that we should go back and look at the old ones and see what from 2022 and then any from last year. But any other thoughts, committee members? I'll ask, I guess, the other committee members, do you agree with what Shayla said about recycling and looking back at the old ones and see if those are ones we need to update? Go ahead, Christine Payson.
Thank you, Christine Payson, for the record. Yes, I do agree with what Shayla said, and I don't know that I have a specific idea of anything that I want to accomplish, but I did recently give a presentation to the Nevada Sheriffs and Chiefs Association, who I represent as a member of this committee. So what I will do now is put it back out to them, given that they've got an update what we've done so far, and see if they'll give me any input on what they would like to see. So I might get some information from them, be able to bring that back for the next meeting.
Oh, that's great. Thank you. I appreciate that input. So it sounds to me like we do want to go back and look at some of our previous recommendations, see if those needed to be updated, add more information to them or refine them. But then also per Shayla's recommendation is to look at those required areas, like I think it's L, N, P, I can't remember them exactly, but we'll look back and see if we have any recommendations that would specifically cover those areas, or if we do refine previous ones, if those would include those recommendations as well. Does that sound right to everybody? Do we
Sounds good.
have, I was just gonna say, do we have a motion to go forward with that?
This is Shayla. I'll make a motion to go forward with what you just recapped.
Christine Payson, I'll second.
Okay, good. So we'll work on pulling all that information and kind of use that as our marching orders to go forward. And the one thing I would add that I forgot to add is if Christine comes back from the Nevada Sheriff's and Chief's office with any recommendations they may have, provided to her as her being the representative of the Nevada Sheriff's and Chiefs, we would also look at those as well. We'll go ahead and take a vote. All members who agree, say aye.
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 Any opposed? And any abstentions? Okay, we'll go ahead, and I would say if we have any presentation request or soliciting additional presentation information, and Crystal, do you have the recommendations for presentations so far?
I do, and I have them on the next slide, and then I think there was one that you emailed about Chair Kearns that I wasn't sure if we wanted to add, which was law enforcement distribution of naloxone.
Okay. We'll go through, these are some of the current topics. And I had brought up the Oregon drug decriminalization. As we know, there was the decriminalization, and I think they just passed law to criminalize what they had previously decriminalized. So, there's a lot of information out there, but I hope to get, from those from Oregon to come to us and talk about what didn't work, why they decided to change it, what they saw as maybe gaps or areas to improve. So that was something of interest to me. Also, the mobile response. I know under the Fund for Resilient Nevada, they have funded some mobile response teams. These are primarily in the north. So to get an update on what those mobile response teams will look like, what they will be doing versus what they won't be doing, and what areas they're going to cover. Another one was workforce, and that's that P is how that all of this affects the state's economy. So there was a recommendation previously about looking at workforce within the state. So that was something, and I think we looked at that, but we just couldn't get it scheduled. Is that correct, Crystal?
We did have a recommendation for a speaker, but we didn't have any recommendations that it connected to. And so I think it's something to potentially address this year.
Okay. And then the Good Samaritan law, did I submit that? I don't remember if I did.
I believe so in prior years. And I've just heard that it's something that we may want to continue to discuss. So I put it on there.
And that may be a case of having the Opiate Technical Assistance Center come and talk about what they're doing at this point. You can see our meeting dates are May 7th, June 4th, August 6th, September 3rd, November 5th, from 11 to 12:30. So if anyone has any other thoughts on presentations that they would like to see. I had a thought for another one, and this may just be based on my background and experience. I think some of you know, previously having been a nurse, I worked in the area of donation and transplantation. And I was talking to someone from the Nevada Donor Network, and they brought up how the fentanyl crisis is affecting donation. It's something that most of us don't think about, but it piqued my interest. So if that's something that the committee members are interested in hearing about, I would recommend that as well. Any thoughts from the committee members?
Christine Payson for the record. I'd definitely be interested in hearing about how it's affecting the donations.
Oh, okay, great. Thank you. Do what we have listed, does that look good to everyone? To have presentations on all of those?
Yeah, I think that's an excellent place to start for sure. That's a lot all in itself.
It is. And one of the things, I don't know if it'll be preemptive or if we'll even be able to, but I would love to hear from I don't think it's statewide, but some of the jurisdictions that are using the wastewater for how they're using it, and if, it leads into any of their response plans. I know, Shayla, that was your recommendation, but I just found it interesting.
I think there's a lot of room to do additional research there and to look at the way some of our neighboring states are utilizing that for sure.
Okay, I don't think we need to take a vote on this, or do we, Crystal?
I don't think that's necessary because I think it'll be an evolving list.
Yeah, I agree.
And pursue these items at this time, and as we change, we can add more or prioritize when we get closer.
Okay, that sounds good. Then we'll go ahead and move on to the next agenda item. So this is to discuss the report out for the April 10th SURG meeting. Basically, I will tell you that I think all of the subcommittees, as I mentioned, are going through what we did, going through kind of reorienting and then asking those questions. So I don't think there will be a lot to report out in terms of recommendations of those sorts of things. But I know one of the highlighted areas is any presentations that we may be looking at, to have all of the subcommittees talk about possible presentations, because they may affect more than one subcommittee again. So so that is primarily what we'll be talking about. I think also a template just to tell what each of the subcommittees did in the reorientation, and going through and just discussing how we're going to go through to get to our recommendations. Anything else that you want to add, Crystal?
That captures it.
Any thoughts from any of the subcommittee members on anything else you feel we should be, or does that adequately fulfill what we want to bring forward to the SURG for that for the April 10th SURG meeting? I take that as tacit agreement. Okay, that sounds good. That's what we will move forward to do. And then we will open up again to public comment. If there's anyone who would like to provide comment. Again, if you're on the Zoom, raise your hand and we can get you unmuted. Please allow 3 minutes. No action may be taken. And if you're dialing in, dial that 669-444-9171 with the meeting ID of 868-3331-1069 and press *9 to unmute. Any public comment?
I'm not seeing any virtual hands raised. It's also okay to come off of mute and be recognized by the chair if you can't find the raise your hand button. Or if you aren't joining on a computer.
Thank you for that permission. My name is Sarah Adler. Can you hear me?
We can hear you, Sarah. Please go ahead.
Okay. Thank you very much, Chair Kearns and hardworking members of the Response Committee. My name is Sarah Adler. I am with Silver State Government Relations, and we are proud to represent the recently formed Nevada Opioid Treatment Association, which is a collaboration of OTPs, opioid treatment programs. And we are putting ourselves forward as a group that would very much appreciate the opportunity to be a presenter to you. This group of hardworking clinics also sees themselves as part of prevention, as well as definitely part of response. I want to share my email address. Any SURG members who would like to learn more about NODA as you are forming your recommendations, we would super love a little bit of your time So again, I'm Sarah Adler, and Sarah at ssgr.us is a good way to get a hold of me. So thank you very much for your hard work. You get through a lot of dense information very well. Appreciate your time.
Sorry, Chair Kearns, this is Crystal Duarte. I wanted to check with Maddie to see if she got Miss Adler's email.
I was gonna say, Miss Adler, can you put that in the chat so I can just make sure I get that fully correct?
I will attempt that. I've been driving in Las Vegas, and but so far so good. I will attempt that.
Okay,
Thank you.
yeah. Or you can just say it again too, and I can just write it down right now.
It's Sarah with an H, SARAH at ssgr.us, Silver State Government Relations. So ssgr.us. Thank you so much.
Perfect. Thank
If
you.
you would put it in the chat for me, and anyone who wants to reach out, that would be super terrific. Thank you so much.
I think we have to limit the use of chat, so I'll
Sure.
just hold off on, I don't know that we'll do that, Miss Adler, but we can make it, it will be part of the meeting record.
Thank you so much.
And thank you for that and the offer for a presentation. It sounds like that may well be one that would be for all committees or for the whole SURG as opposed to one specific committee, but we'll be in touch on that. Any other public comment?
This is Crystal Duarte again, and I'm not seeing any, but would say to others on the line that if you'd like to do what Miss Adler did and just come off mute and be recognized by the chair, you can also make public comment that way. I don't see or hear anyone attempting to make public comment at this time.
I don't either. So we can move on to the next agenda item, which is the adjournment of our meeting. And thank you all for bearing with me. I know it was a lot of heavy, and listening to me talk the whole meeting was probably not your preferred method of having a meeting, but I definitely appreciate you guys hanging in there with me. But as a reward for that, I'll give you back 30 minutes to your day. So the meeting will now be adjourned. Thank you.
Thank you, Terry.
Thank you.